Good morning, everybody. This is Laura, and thank you for listening. This morning's show is going to be a lot of fun with our guests from Music Therapy Associates. Rachel and I often talk about the importance of engaging different areas of the brain, and our Cognitive Therapeutics Method and MindFit series both promote this platform.
That's right, Laura. Different types of activities engage or exercise different domains of the brain. Just some examples. Strategy games engage executive functioning skills. Social reminiscence works coping mechanisms and memory. Picture puzzles are good for visual and spatial perception, and social recreation is healthy for both physical functioning and mental health. The list can really go on and on. Whether you consider these activities and how they engage different cognitive functions, you realize that participating in various forms of arts actually engage multiple, if not all, areas of the brain.
And that is why we are so excited to introduce Kathy Purcell, Mary-Cate Carr, Julianna Altonjy, and Chris Morrison from Music Therapy Associates.
Hello.
Shake a friend's hand, shake a hand next to ya. Shake a friend's hand and say hello.
Shake a friend's hand, shake a hand next to ya. Shake a friend's hand and
say hello. Say hello to them.
Hello, hello to you.
Say hello
to you. Hello, hello
to them.
Sing to Laura and Rachel. That's good.
That's great. So just to give you a little bit of background, Kathy is the director of Music Therapy Associates, and she is a board-certified music therapist and Pennsylvania State-certified music teacher. She graduated cum laude from Shenandoah Conservatory in '89 with degrees in both music therapy and music education with a minor in psychology. And she currently provides services as a contract music therapist for various agencies and individuals at the agency's facilities, at clients' homes, or in her own studio. There is a lot more I can say about Kathy's expertise in individual and group music therapy sessions relating to a great variety of conditions, but I want to let her talk more about how music therapy benefits this. We also have Chris, who graduated cum laude from Marywood University with a bachelor's in music therapy and completed his internship at Monroe Board of Cooperative Educational Services in Rochester. His experience includes educational settings as well as residential care settings where he's worked with older adults who were diagnosed with dementia. And he also has experience as a drum circle facilitator and musical instrument lesson instructors, and continues growing as a percussionist by playing drum set for his church worship band. Mary-Cate is a board-certified music therapist who received her bachelor's in music therapy from Temple University. She completed her clinical internship at Rebecca School in New York City and has experience working individually with groups of children and adults on the autism spectrum, children with various neurological disorders, hospitalized children in rehabilitation units, and older adults in various stages of dementia and Alzheimer's. And Julianna graduated cum laude with a Bachelor of Music degree in music therapy from Marywood. She completed an internship in Southbury, Connecticut at the Southbury Training School and with Connecticut Music Therapy Services in Watertown. She has experience working with individuals who have intellectual and development disabilities, children in integrated preschool programs, adolescents with behavioral problems, hospice care patients, and individuals diagnosed with dementia or mental illness. So between the four of you, that is a really long list of qualifications. And honestly, in the interest of time, there is a lot more that I didn't mention. But I just wanted everybody to know that you are all really, really qualified in your field. And to go with that, why don't you start out by telling us a little bit more about what is music therapy?
Sure. So this is Kathy. Music therapy is the use of specifically designed musical interventions and the relationship between the therapist and the client to achieve goals that are not necessarily music related. So sometimes it can look like music lessons or just playing music for someone, but the goals are totally different. The goals are based on that individual's interests as well as their needs.
And what's the history of music therapy? How did it come about, and how did you start here?
Chris. Or Mary-Cate.
So since ancient times, but really for like thousands of years, music's been shown to have a positive effect on mental health and physical health. And specifically after World War I, they found that soldiers responded to music when other therapies weren't as successful. So in 1950, the National Association of Music Therapy was founded, and then another music therapy association was founded a couple years later, and then those two combined in 1998 to make the American Music Therapy Association, which is what we have now. And I think there's 5,000 music therapists in the country right now.
Wow.
Yeah.
That's great. Now, we already kind of went over all of your individual, not all of them, but some of your individual qualifications. And Kathy, there's a lot that I didn't say about your experience, because I know you have experience with tons of different types of conditions. Do you want to talk a little bit more about that?
Sure. So as a music therapist, you get a general degree in music therapy, and then you gain experience working with different types of populations. And Chris is actually going to cover what is required to become a music therapist.
Okay.
Because it's not, as you were saying before, it's not just somebody off the street that likes to play guitar or likes to sing. There are specific criteria that you have to meet in order to be a board-certified music therapist.
Okay, Chris?
Yeah, so believe it or not, we actually have to go to school, go to college. So you actually need to obtain an undergraduate degree, a bachelor's degree in music therapy. Now you can go further and get further education. You can get your master's. You can actually even get your doctorate in music therapy. But in order to practice, you need an undergraduate degree, a bachelor's degree in music therapy. You have to complete a 6-month internship. And then upon completing that internship, you have to take a board exam. And then once you pass, you are certified to say you are a music therapist, and then you can practice. And then within the next 5 years, you have to obtain at least 100 CMTE credits. They're continuing education credits that you need just to continue to practice in the field.
Awesome. So why don't you tell everybody a little bit more about what exactly you do when you're with your clients or patients?
Sure. As music therapists, we are designing specific music interventions. We work with clients to use listening, singing, songwriting, playing music, moving to music, and all of those things are done to enhance the person's life, to help them with whatever their needs may be. And that's determined through an assessment that we provide. It generally takes us 3 to 4 sessions to do a complete assessment, and we're assessing all different areas of functioning and then designing the musical interventions to best suit that specific client.
Very good. And I know we talked about you perform in a variety of settings. Specifically, how does it work for somebody who's homebound?
So we would work on communication, to increase or improve their communication skills, whether it's like physically communicating with their eyes, with their voice, whatever it is. We can also work on gait training, helping with their motor skills, walking, moving their arms, picking things up. We also work on socialization. Socialization with other peers or with the therapist. We can also help them relax. We also, by relaxation, we can help decrease pain and also decrease the need for medication with certain clients. And we can also go back and do like a life review for them, help them reminisce, work on their quality of life. And music's just fun. So
Yes,
generally
absolutely.
we get a good response from music in general.
And some of the things that you were just mentioning as far as decreasing medication are things that people would probably not normally think of relating to music therapy. And there's a lot of things that music therapy improves and provides and increases. Do you want to talk about maybe a couple more of the things that people wouldn't normally associate with it or think of until you put it that way?
Yeah.
Sure. Well, we do work with people of all ages and abilities. So we can work with teaching people specific skills, and that can be for children, but it can also be for those who have suffered from an accident or an injury, or those recovering from a surgery. So oftentimes if someone has, say they've had a stroke and they aren't able to speak or speak clearly, we can work with them to do that. If they're having memory issues with like naming objects and things like that, we can work to help them with that particular skill that they would need. And so we not only work with the individual and assess them, we're also assessing the whole situation. So we're working with the caregivers, be that family members or hired people that do come in, that it's a great opportunity for the individual and the family and caregivers to connect in a different way than they do in other situations. And it's often really helpful to give those caregivers an opportunity to see their loved one or the person they're caring for in a totally different light, in a way that they can see, wow, this person really is responding there, where in other areas they're really not. And so they can see that they're actually able to work with us to show they like this or they don't like this, or yes or no, or they need help, or this makes them happy, things like that, that they may not be able to get those responses in other ways. And that's basically because music is processed through the entire brain. And so even if they lose certain aspects of their memory or different skills, through music we can pull from different areas to have them be as functional as possible.
That's wonderful. And what types of things do the clients do when you're working with them?
Yeah, so the clients do a lot of different things. They sing, they play different instruments. Sometimes we just have them listen to music, and that may be to do some type of lyrical analysis. If they're working through something, just look at the words, talk about that. They write songs together with each other or with the therapist. Sometimes we do a little bit of movement to music, so the clients will do a little dancing, a little movement, work on those gross motor and fine motor skills. They learn to play an instrument or sing, so sometimes we do a little teaching just to make it engaging and as effective as possible. And sometimes we even do drawing to music. We extend it even further and try to reach outside the box to try to do different things that, works effectively for whichever individual, whichever group we're working with.
That's awesome.
It is important to note that we're doing what's most effective for that specific client. So if you have a client that says, I don't want to sing anything, don't think that they can't have music therapy because they don't want to sing, or because they don't want to play an instrument. We just have to be allowed in the room and have them not kick us out. So as long as we're there, we can do something that will benefit them through music therapy.
And I would imagine that even if somebody is resistant at first, once you do start to interact with that person, however they may be most comfortable interacting, that they really do open up to it.
Right. Everybody loves music.
Exactly.
Whether it's listening or singing along or tapping, I think on some level everybody enjoys music, and can be really fun for everybody.
Yeah, so we just have to tap into what's going to connect for that person. And we do that through actually, trying some different interventions with them, but also beforehand, we try to get some information from the family members or caregivers, or from the individual themselves of what they prefer, what they like, what they don't like, so that we can design it to be the most fun and effective for them.
Okay. And speaking of fun, I think you were going to do another song.
Yes.
Yeah, you definitely use my guitar.
Just banked on you bringing it in. Okay.
Oh,
Ooh,
do you want to pick?
Yeah. This is called Sing When the Spirit Says Sing. So if you get it, feel free to sing with me. You gotta sing when the Spirit says sing. You gotta sing when the Spirit says sing. When the Spirit says sing, you gotta sing right along. You gotta sing when the Spirit says sing. Ooh. Oh, we have some shakers. Let's shake. You gotta shake when the Spirit says shake. You gotta shake when the Spirit says shake. When the Spirit says shake, you gotta shake right along. You gotta shake when the Spirit says shake. All right, so what's something else we could do when the Spirit moves us? Anyone have an idea? Sing. Can we clap? How about clapping? Can we clap? Here we go. You gotta clap when the Spirit says clap.
You gotta clap when the Spirit says clap. When the Spirit says clap, you gotta clap right along. You gotta clap when the Spirit says clap. Let's snap. You gotta snap when the Spirit says snap. You gotta snap when the Spirit says snap. When the Spirit says snap, you gotta snap right along. You gotta snap when the Spirit says snap. You gotta stand up when the Spirit says stand up. I'm talking to you. Yes, I am. You gotta stand up when the Spirit says stand up.
Stand up.
When the Spirit says stand up, you gotta stand up right along. You gotta stand up when the Spirit says stand up. You gotta sit down when the Spirit says sit down. You gotta sit down when the Spirit says sit down.
Sit down.
When the Spirit says sit down, you gotta sit down right along. You gotta sit down when the Spirit says sit down. You gotta sing when the Spirit says sing.
Come on, sing.
You gotta sing when the Spirit says sing. When the Spirit says sing, you gotta sing right along. You gotta sing when the Spirit says sing.
Thank you so much, Mary-Cate. That was awesome. And I'm sure what people listening at home are not realizing is all of those different things are really engaging not only different areas of the brain, but different areas of the body. So it's really all-encompassing. That's really great. Now, we talked a lot about what music therapy is, but why don't you tell us more about Music Therapy Associates specifically?
Sure. Music Therapy Associates started back in 1990. And I was looking for a really catchy name that would be really cool to name my new company. And my husband said, Music Therapy Associates, that's the name of your company. And I said, no, I want something really cool. And he's like, what do you plan on doing? And I said, provide music therapy services. And he said, so that's the name. And I said, but it's only me. And he said, do you plan on having other people? And I said, of course, because I can't do everything. I can't be the best therapist for everybody, and I can't clone myself. So he said, so Music Therapy Associates is the name of the company. So I said, okay, well, we'll stick with that until we find something really cool. So we've been Music Therapy Associates since 1990.
Very good.
But it's great because it explains exactly what we do. We currently have 17 board-certified music therapists.
Wow.
That travel throughout eastern Pennsylvania and western New Jersey. We have therapists from up in the Scranton, Wilkes-Barre, Stroudsburg area. I'm very directionally challenged, so pardon me. Down to the South Philadelphia area, as well as into New Jersey, out to the Kutztown, Reading area as well. And throughout, of course, Allentown, Bethlehem, Easton, Greater Lehigh Valley area.
Of course. Now, supplies and instruments and equipment that you're using, because there's some things here that normally we wouldn't think of with music therapy. Again, can't see it, but some things don't make noise. So we go over a little bit about different things that you use, what kind of instruments you use, some of the other things that you use for tactile.
So we use we use obviously the what is that called? A scarf?
A scarf.
Scarves really help with movement. I've used bubbles. Especially with little kids who like bubbles, but adults like bubbles too.
Everybody likes bubbles.
It engages them.
My dog likes bubbles.
Yeah.
He chase them.
Yes.
Yeah, bubbles, balloons, like a balloon drum, blow up the balloon and pound on the balloon. What else have you used? We use markers and crayons. We've had people, draw to music, but also draw the guitar. If they're learning guitar, they draw the guitar and mark where your fingers are supposed to go. And what else?
Well, commonly we do use things like every therapist, to be a board-certified music therapist, you need to be able to play guitar, play piano, and sing. So, and beyond that, some of the therapists do have other specific instruments that they are familiar with, have learned, perform with, and so forth, or work with their clients. So the non-musical things that you can't hear on the radio, like Mary-Cate was saying, we also sometimes do use puppets. We use hats or masks. I've used books a lot as well. And we also try to give people a full sensory experience. So not only are they experiencing the music, but they may be doing tactile things like we sometimes have brought in a bucket of sand or use some aromatherapy type of things with particularly coconut oil the scent of coconut. So for like to experience a beach type of theme or other kinds of scents that may be familiar to them, like baked apple pie or things like that.
Awesome. Okay, we're going to do some drumming.
Yes, definitely.
Very cool.
So we need the drums. So we got drums over here, so let's get those out.
Who's doing what drum? Are they?
You guys should let's give them a drum. They definitely
Here,
need
how
a
about if
drum.
you take this drum? And I'll give them this.
Oh,
'cause this
I get a drum?
You're going to have to stand up.
Okay.
Or if you can make the chairs
there we
go
go.
really low. This one can stay flat. You don't have to tip it.
Very good.
So if you can, I don't know if you can.
No, I'm actually
Okay.
we did the same. We did at that presentation. Okay, you want this one?
Yeah.
Okay. So you have your drum.
Got our drum.
All right, you're comfortable with it? Everybody's got something they can use? All right, great. It's going to get pretty loud in here. All right, so we're all going to play, so you may recognize this song. It's We Don't Want to Work, we just want to play on our drum all day.
Oh, yeah. There we go.
All right, now I may shout out, some people are going to have to get solos here.
Uh-oh.
So be ready.
There
So we're all going to play together at first, but just be ready if you hear your name called out.
Oh gosh.
And it's your time to solo. We don't want to work. Here we go. We just want to play our drums all day.
We don't want to work. We just want to play our drum all day.
All day. All day. All day. All day. All day. All day. All day. All day. All right, Laura, here's your solo. Laura doesn't want to work. She just wants to play on her drum all day. Laura doesn't want to work. She just wants to play on her drum all day. 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 Everybody. We don't want to work. We just want to play on our drums all day. We don't want to work. We just want to play on our drums all day. 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 Let's have one more person do a solo here. Mary-Cate, you ready? Mary-Cate doesn't want to work. She just wants to play on her drum all day. Mary-Cate doesn't want to work. She just wants to play on her drum all day. 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 Everybody, one more time. We don't want to work. We just want to play on our drums all day. We don't want to work. We just want to play on our drums all day. 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 All day.
Awesome.
All right.
All right. So, why don't you tell us what benefits we got from that?
Sure. Well, why don't I ask you? What do you think we accomplished there for you?
Got my heart rate up.
Good.
Very good. We had sensory tactile with the drums.
Right. You were using good eye-hand coordination. So
Well,
you were
me not so much, but you know,
Well,
it's okay.
you did a very good job, Laura. Yes. What else were you doing there?
Listening.
Having fun.
Yes, having fun.
You were having fun. You were listening. You were following directions. What else were they doing there?
You're given the opportunity to like lead a little bit, you know, express how you wanted to play in the moment. So some of you got that opportunity. What else?
Yeah, so that's important because sometimes people, especially if they're ill or they're recovering from an accident or an injury or they're declining in their health, being able to actually make choices and express themselves is really important because often many other things in their life, they don't have the opportunity to make those choices. They don't have the chance to, you know, really have a decision in what they're doing or how they're doing it.
Very good. Kathy, is there anything else important that you want everybody to take away from this? And then why don't you tell everybody then, too, how they can get in touch with you?
Sure. The main thing I want people to know is that we are available to do individual and group music therapy for people wherever they are located. And one of the benefits is that we can come to people at their homes or if they are in an assisted living facility or in hospice. But we can also go with them as long as they're within our service area. So it's very comforting for someone that has had our services in their home. If they do have to go to the hospital for a surgery or an illness, that we can also see them there as well, which needs to be cleared, of course, with the hospital and so forth.
That's wonderful. And I can't imagine the hospital refusing that because that's such an important part of the recovery as well.
Right. It's just something that needs to be coordinated, of course. But also, people can do a lot with music on their own. So we do want to encourage people to be conscious of how music affects them and their loved ones, and also how they can use the way music makes them feel and helps them on purpose to improve their own lives and the lives of those that they love. So work with those that you love, and if you feel our services are beneficial, you can give us a call. We'd love to help release the healing power of music to help those that you care for.
Wonderful. And if you want to give everybody your phone number or your
Sure.
website or email,
Sure.
that's fine too.
You can look us up online, www.musictherapyassociates.com. We are on Facebook at facebook.com/musictherapyassociates. There's that catchy name again. And our phone number is 610-740-9890. And the email is info@musictherapyassociates.com.
Awesome. Thank you so much, everybody, for being here today. I think it was a lot of fun. So thank you, everybody. And we're just going to say that we hope that you all enjoyed today's Changing the Way the World Ages as much as we did. Again, for more info on home care assistance, you can visit hcalv.com anytime. Call us at 484-350-3874. Email us at info@hcalv.com. Facebook, we're Home Care Assistance Lehigh Valley, and Twitter, we are at HCA Lehigh Valley. So thank you for allowing us into your home this morning. Until next week, take care.